Hi, I'm Sheila Erickson, and this is Searching for Healing. Over 650,000 Americans died of cancer last year alone. That's more than a World Trade Center falling every day. 1 in every 12 Americans has an autoimmune disorder because of the chemicals in our environment. You see, if what you get is only 30% genetic and 70% is your lifestyle, meaning what you eat, the sleep that you get, and how you handle your stress, then by changing your lifestyle, you have a fighting chance of survival. Join me as we talk to experts from every field, from all 4 corners of the earth, whether you're suffering from issues such as cancer, diabetes, high blood pressure, autoimmune disorder, obesity, depression. Maybe like me, you're healing from the loss of losing a loved one. Searching for Healing is my gift to you. On today's show, we're going to talk to Deborah Long. She's a health consultant of over 38 years. And then you'll meet Bradley Childs, who's had cancer several times, and you'll hear his story of survival. Next, we'll meet Kathleen Mason, a nurse of over 25 years. She plays Green Kathleen on our show, a nutritional guru. And then we'll also meet Deidre Soper, who is a 2-time cancer survivor, and you'll get to hear her story. And then you'll meet Easton Soper, Deidre's lovely 8-year-old boy. You'll find out how Easton survived his mother's cancer and recovery. And then we'll meet Nancy Ludwig, a craniosacral therapist. And what does a craniosacral therapist do? Stay tuned. And then we'll meet my hero, Dr. Lou. She's a herbologist and acupuncturist. She saved my life. We will then learn about a computer software program that Dr. Lou's son designed. And of course, throughout the show, you'll meet Danny James, the embodiment of disease. Let's go meet our guest.
Hi. Whoa. Nothing wrong with me. I'm exercising. Sometimes I have low blood pressure. And sometimes I have high. Hi. Whoa. Nothing wrong with me. I'm exercising. Sometimes I have low blood pressure. And sometimes I have high.
Last time we talked, you were talking about something being the legal cocaine. So I want you to tell America what the legal cocaine is.
Well, it's sugar, you know, because I really do believe that, because it's something that's readily available, everybody can eat as much as they want of it, and it truly has no nutritional value whatsoever for us, and it's making the country really sick.
How can sugar make the country really sick?
Well, because it changes our acidic levels in our body, and creates us to be very acidic, which disease loves to live in an acidic body.
Like?
Cancer, lupus, a lot of our diseases nowadays are inflammation diseases, I believe. Obesity, sugar diabetes, is rampant among young children. And if you look at what our young children are eating, they consume large amounts of sugar.
And that's what Searching for Healing is all about, is natural things without harmful side effects.
Yes. And I mean, even our doctor community is getting on board with this, because we are taking too many prescription drugs, and it's just, once you start taking one, you're on to another. And we just want to create a different environment where we have better choices, that we don't necessarily have to do drugs, that maybe we can try something else before we have to go into drugs.
I love it. I love it. Deborah, thank you so much for coming on our show today.
Acidic, 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 acidic. Down with alkaline-based bodies. Hey, Bradley. Your old pal.
Wait, what do you know about cancer?
Well, cancer is caused by abnormal cells.
Okay.
And there's over 100 different types of cancer. Radiation causes cancer very easily. It's a big cause of cancers, radiation. And pancreatic cancer is a cancer that can't be cured. And leukemia is another cancer, and it goes to the bloodstream. So it travels very quickly.
So I'm dying to hear of the prognosis and everything,
Go
huh?
ahead, relax, guys.
Okay,
Come on in.
awesome.
Yeah.
Here we are back at your home.
Yeah.
And so tell me what's happened.
Well, since we've been back, we've had the experience of, of course, the pain, that having the, having the bag. I've had to wear the bag for these 10 days, and of course, it's very hard to go anywhere when you have that bag hanging down. So you deal with that in a very emotional way, a very physical way, and...
Hi everybody, my name is Bradley Child. I was given this wonderful opportunity here to tell my story, what I've done to myself medically, and how I've been able to put myself through the process of healing throughout all these years. One thing I have to always talk about here is the damage I did to my body. I had ulcerative colitis, which could turn into colorectal cancer. I could get bladder cancer. I've had skin cancer. I have prostate cancer. When Sheila approached me about this and showed me different ways to do things, I took it to heart. It started feeling really good. I'm doing something for my body. The levels I was putting myself under was stupid. I was killing myself. I was almost pronounced dead. All the stuff I've been doing to my body has caused major problems for the level. My stress level is so doggone high. I was drinking drinks that had plenty of sugar, drinking coffee that had sugars and cream in it. I was literally destroying my body. And I kept on doing it to the point I was at death's door.
Look at this. Nice and dead.
Now it's changed. And I'm not going to go back to the way I was before. I'm going to just keep going forward. And that's like what I'm doing now. And man, I tell you, I am feeling amazing. It's really working.
That feels so good. I feel lethargic afterwards. I just want to sit on my couch and watch TV after I eat this.
Hi there, I am Green Kathleen, and I am here to talk to you about raw foods, live foods, and dead foods. Raw foods are foods that you see right here. They are raw fruits and vegetables right off the vine. Dead foods are what you find in the grocery store that are processed, right in the middle of the aisle there. They are foods that have been cooked over 105 to 118 degrees Fahrenheit and processed. So, these foods are processed dairy. They are also cooked foods, and then the processed packaged foods, especially the sugary foods. Now, if you eat these dead foods, it will put your body into an acid state. Now, disease loves acid states, and it will thrive and eat up everything it can, and it will grow. But if you eat the raw foods, then it will go into an alkaline state, which makes disease very hard, if not impossible, to live in. So, if you want to know how this all happens, I'm here to tell you. If you eat raw foods has its own enzymes in them, and it's live. So when you eat them, your body uses those enzymes to digest the food. Now, if you get processed foods or dead food, then your body has to make up those enzymes all by itself with your immune system and your pancreas in order to process the foods. Now, if you keep doing that, it puts your body into overdrive. Your body is only made to make 50% or less of the enzymes for your food. Think about that. How much processed foods do you eat? Are you eating 75 to 100% processed foods? That means your body is making all those enzymes all the time. So what does it have left to do? It's pretty worn out. So it doesn't have enough energy to fight against disease or cancer or allergies. So give your body a break. Let's try something new. Let's eat raw fruits and vegetables with its very own enzymes, all intact. This gives your body a break. This lets your pancreas and your immune system be strong. And what will happen? What kind of gift will your body give you for that? They will fight your diseases, your cancer, and your allergies. Make your body your hero. I'm Green Kathleen, and this is Searching for Healing.
Red Delicious apples, Granny Smith apples, kale,
Boo with alkaline-based bodies.
She can have it.
We need more sugars.
And, we're hoping
more
that it's going to help
carbs.
lift her spirits a little bit, help her sugar cravings, and oxygenate her body and make it more alkaline instead of acidic.
Hi, my name's Deidre Soper, and I am a cancer survivor, and I was approached by Sheila Erickson to tell my story. I was diagnosed with Hodgkin's lymphoma in March of 2009, and then again with a relapse in March of 2012. With the relapse, the chemotherapy that I had to take took everything out of me. It just killed everything. And so that they could do the bone marrow transplant. But with that medicine, it really wreaks havoc on the throat and the tongue, taste buds and everything. I just couldn't get things down. So one of the things that helped me was the green drinks that Sheila brought to me. She was kind enough to bring them up to the hospital. And it was really nice to have something that tasted good, I knew was good for me. So I tried drinking those as much as possible up until I couldn't do anything. And then after that time frame of not being able to eat, I started back up with the smoothies, and I think that helped tremendously, help me bounce back. And I was actually out of the hospital in exactly 3 weeks. And also chemo, you know, going through it, it makes you crave sugar. But this time, with having the smoothies, it had that sweetness in it. I could taste it, which was awesome because I could hardly taste anything. But it had the sweetness that kind of, or not kind of, but it did alleviate that craving for sugar from something such as donuts like I had sitting behind my bed, or, you know, a pop. Because I did have those things. I just, I really didn't crave them, nor could I really eat them all that well anyway. But I really do feel that played an integral part in my recovery, and to this day, you know, I just try to keep that in mind and keep eating as fresh as possible, and keep going.
Acidic, 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 acidic. Down with alkaline-based bodies.
My name's Easton Soper, and the hardest thing of my mom having cancer was pulling out her hair and doing if people saw her, it would make me feel like they were gonna approach to make fun of her. But it's not really funny because it's actually really serious. She had lymphoma, and she had a she had to go through a lot of stages of having cancer, and the most hardest thing was she couldn't have any germs when she got some medicine. She can't, she could have got infected. That was really hard for me. She was actually trying to get better, and I wanted to help her through that, so I had to clean myself every day. Usually washed my hands with just water, and I thought they would just come off, so now I just realized that I have to wash my hands with soap so she wouldn't get infected. And that's my story.
Eats. We want sugars. We want carbohydrates. Keep them coming, folks. Keep them coming. They're all ours.
Nancy, you're a craniosacral therapist.
Yes.
And you've been doing this for over 15 years.
Yes.
I came to you about a month ago because I was having a really hard time with some body problems I was having, and also healing from the loss of a loved one. And I wanted you to explain today to everybody exactly what you do.
The cells of our body remember everything that happens to us. The positive things, of course, don't create any problems, but the negative things can bring in all sorts of illnesses and dysfunction. The process I use removes the cellular memory so that when the person remembers a particular instance, there will be no negative energy with it. It's just very, very neutralized. And it really helps them to come to a state of wholeness and well-being. It's just amazing work.
Nancy, who do you assist in their journey towards wellness?
Infants, all sorts of ages. My oldest client is a 92-year-old man. All people have problems, and it really doesn't matter what the age is. It really makes a difference in their lives and can help them move forward. Whether it's depression or they've had severe trauma in their lives, or if they've got aches and pains, this sort of work can really make a difference. All pain and all dysfunction really goes back to memories. We spend our whole adult life trying to heal our childhood. It's just kind of ludicrous, but that's how it is. And this process helps to bring that about.
No medication. So no harmful side effects with what you do.
Yeah, the work I do that assists in the healing process does have no side effects. It just, because it's cellular memory, because it's trauma that's happened to us, that can create all sorts of problems, and that's what needs to get out of the body. Sometimes the medication creates a Band-Aid effect, where the cranial sacral therapy goes into the body to remove what's creating the problem instead of just putting a Band-Aid on it.
I like that. So no medication?
None whatsoever.
You heal the person?
Yes.
I like that. Well, thank you so much today, Nancy, for coming on our show.
And what I have to say about fruits and vegetables?
Hey, 25 years ago, I went to dermatology clinic at a local university. Head over dermatology sat me down one day after extensive testing and told me, Sheila, I found the drug of choice that your body needs for you to be healthy. He said, it's called prednisone. I've put you on it the last couple months and it seems to work. If you take this every day for the rest of your life, you're not going to have mouth sores anymore and you're going to be able to eat. Though I tested negative for everything, prednisone seemed to be the drug of choice for me. The only problem, he said, is that in 10 years I'd be in a wheelchair because it did shut down my adrenal gland and it would also wreak havoc on my bones. So today I would be in a wheelchair if I would have taken that doctor's advice. Instead, I sought out and looked for other alternative. This is an herb. This herb I would put in my mouth every time my mouth sores started coming, and within 30 minutes I had the same result as the prednisone did. That's what searching for healing is all about. Medication or herbs without the harmful side effects.
This is a story here of a woman who lost her hair due to depression. And here she comes in here. They're showing pictures of her without hair loss. And this was in December of 95. By March of 96, she started getting her hair back.
99.
And then 96. And then May of 96, she gets all of her hair back.
This is from acupuncture and herbals.
Yes.
Mm-hmm. This is from acupuncture and herbal.
Dr. Liu, what kind of doctor are you in China?
I'm the doctor in China. I am an internal medical doctor, treat patients.
How long have you been treating people?
Oh, I treat people, patients from China to now, 50 years.
And how do you treat people?
I use acupuncture and herbal. First, I need a diagnosis. What's wrong with the patient? I use Chinese medicine theory and the West medicine theory, two kinds of theory to treat patient and to diagnose it. The software, clinical software inside combined 5,000 years Chinese medicine, acupuncture, herbal, and the combination with white medicine, how to diagnosis for patient.
So basically, you're telling me about the software that your son created.
Yeah.
And his name
That
again
is
is?
Ko-Wei Li.
Ko-Wei Li?
He is in China now. He has a company in China, but he is American citizen here. He was treat patient in China, acupuncture herbal clinic here, because a lot of patients in USA like to use acupuncture and Chinese herbal treatment.
So no side effects?
No side effects.
With any of your herbs?
Because some patients, they try in the hospital, chronic heart disease, they use surgery or chemical pills for years. Not help very much. Also have side effects. So they like to try the natural Chinese medicine, herbal, acupuncture.
And it's been around 5,000 years.
Yeah.
So you were talking about your son that created this software.
Yeah.
And it has a probability of diagnosing 9,000 different illnesses?
Yes.
And not only in Western medicine, but in Chinese acupuncture and herbal as well?
A lot of patients, they like to do more cheap. They buy the software. They use this kind of software. They know how to treat their problems. So this kind of software prevent misdiagnosis. Also helpful. The doctors can use this software, make a more accurate diagnosis, treat patients.
I love it. I love it. Dr. Liu, thank you for being here with us today. And I love you. You're my hero. You always have been.
Bear down. I don't know what else to say.
Thank you for joining us on our show today. I hope the information has been helpful and informative. Join us on other episodes as we continue to search for healing. And remember, our goal is to heal you without harmful side effects. I'm Sheila Erickson.